I thought I had COVID, and I ended up in the hospital. I got up in the middle of the night and collapsed, and they said, "We don't know what's wrong with you. You've got to go someplace else." Once I got to UofL, I was there for about a day, and the doctor came in and said, "You need a lung transplant." Me and my partner, Stuart, started Cattleman's Roadhouse in 2006, and it's been my life. We come to work and take care of the guests, take care of the employees. It's like a big family. And then all of a sudden, I got hit with this crazy sickness. The whole thing was very scary, and you don't have time to prepare for any of this stuff, you know? I was sure I wasn't going to make it. The night I thought I was going to die, they came in and said they found me a set of lungs.
At the UofL Health Trager Transplant Center, we perform adult transplants for lungs, hearts, kidneys, livers, and pancreas. In Mr. Hisle's case, based on how he presented, he appeared to have a rare condition called Hammond-Rich syndrome. When he started to get his illness, he rapidly declined.
Dr. Ramirez takes great care of me. We view him as a rock star. He always has the answer for everything. He's a little more conservative than I would like, and I keep saying, "Come on, Dr. Ramirez, I can do this or I can do that." And we make deals on what I can and can't do. I had my 61st birthday in the hospital. My daughter brought in balloons and decorated the whole room. It was a great time. It was a different birthday experience, but everything during COVID was different. You learn to breathe and how much I have to think about breathing. It's really a different experience. In through your nose and blow out the birthday candles. That's what they teach you to do. They have a lot of signs in physical therapy that says if it isn't challenging you, it's not changing you.
The concept of a team between the transplant center and the patient is key. The patients know that we're on their side, we're trying to help them, we're trying to help them help themselves. So they need to put in a lot of work, we need to put in a lot of work, and when it goes well, we can see the fruits of all that work. Louisville is very fortunate to have a transplant center. Patients need frequent access to their transplant center, and having that right in your own hometown is not only convenient, but it is helpful for the patients, their families, to deal with problems and complications that arise.
I plan on still working a limited amount in the restaurant. I don't plan on working as hard as I used to, but for the next 5 or 6 years, I plan on still doing what I used to do.
That is incredibly satisfying to take patients who can now have a bucket list and complete the bucket list. That is thrilling. When patients can tell me about the things that they do, those are the things that make my day.
I was really lucky that Trager Transplant Center could do this. I don't think people realize how important organ donation is. I almost didn't live because they couldn't find me a set of lungs, and I was just extremely lucky.